My name is Paul Sinclair. I'm a Sydney-based community pharmacist and I'm the president of the International Pharmaceutical Federation. My career started some 35 years ago. I have owned community pharmacies in Sydney for most of the past 30 years. I've had a long engagement with representative organisations here in Australia, notably the Pharmacy Guild of Australia at a national level as Vice President and at the state level, New South Wales President. I've been involved with the New South Wales Pharmacy Council, which is the professional regulator here in New South Wales, which regulates both premises and practice of pharmacists in New South Wales. And I've had experience as chair of the Australian Association of Consultant Pharmacists. Significant points of time in my pharmacy career which have directed me as to where I am now. Firstly, I think my engagement with the Pharmacy Guild some 20 years or so ago. I started out as a representative of the New South Wales Branch Committee and ended up as the National Vice President. But most importantly in that process, I was involved with negotiations for the community pharmacy agreements, which is the commercial arrangement between the Pharmacy Guild and the Commonwealth for supply of pharmaceutical benefits to the Australian population. This experience certainly showed me the value of strong advocacy for our profession in terms of introduction of professional services into the agreement and for the betterment of our profession in getting access to funds for those services as well as dispensing services in the community pharmacy agreement. I think the next major point in my pharmacy career was my engagement with the Pharmacy Council of New South Wales. They're the regulator of the profession and premises in New South Wales, and this certainly opened my eyes to the importance of regulation in our profession. We are a highly regulated profession, but I saw here the problems that pharmacists can encounter because they either don't understand or they don't adhere to the relevant legislation and guidelines by which we should practice. We're all very busy, but sometimes being so busy causes some big issues for pharmacists in terms of getting themselves into professional jams and practice which is not at a level which we would consider to be appropriate. The next major point in my career, I think, was when I was asked by a well-known Sydney pharmacist to stand for election for the Community Section Pharmacy Exco of FIP. This was in Lisbon in 2010, and I was successful in getting elected to the Exco. Over the following years, I progressed through the structure of FIP to be president of the Community Pharmacy Section. I was then, at the end of that term, elected as the chair of the Board of Pharmaceutical Practice, which was one of the three main pillars within FIP. And at the end of that term, in 2022, I was fortunate enough to be nominated for election for president of FIP, and that was successful last year in Seville, and I've had the past 12 months as President-elect. Most unfortunately, the incumbent, Dominic Jourdan from Switzerland, passed away 10 days ago in Switzerland. So I'm now in the role of acting president until the start of Congress in late September. So there have been some critical points in my timeline, all of which have guided me fairly strongly in decisions I've made. And I must say that those decisions have opened up a number of other opportunities in terms of representing our profession and being an active player in both advocacy and regulation. FIP is a global organisation which started in 1912. It represents over 4 million pharmacists globally and is headquartered in The Hague in the Netherlands. FIP is about promoting pharmacy worldwide and promoting pharmacy in all its disciplines. We have three major channels in FIP: pharmaceutical practice, pharmaceutical science and pharmaceutical education. FIP has developed some development goals which feed into everything we do, all the resources we provide and develop, and everything we do is both influenced by and fashioned by science, education and practice. FIP has a number of members, organisations within Australia, and those organisations can access significant amounts of resources which are developed by FIP, whether that be our non-communicable disease program, which was developed over the past 18 months, whether it might be access to webinars which will help practitioners in various disease states and any other number of topics. But FIP is a partner to those member organisations in supporting their members in their practice of pharmacy. The 81st World Congress of Pharmacy will be held in Brisbane from September 24 to September 27. The theme for this year's Congress is Pharmacy Building a Sustainable Future for Healthcare, aligning to goals for 2030. And that refers to the UN Sustainable Goals and the FIP development goals, which I mentioned earlier. There are four main topics for the conference this year. The first one is global solutions for global health challenges. We've just come through a pandemic, and that has informed a lot of what's happened in our practice and in our practice development. We'll have examples from member organisations from across the globe of initiatives that have taken place in their countries. The one big benefit of FIP is that it is sharing information, it is sharing experiences and sharing resources. The second channel is Together for Better Health Outcomes, and this is very much we hear in pharmacy speak today about interprofessional collaboration and collaboration within our own profession. We will have a number of presentations on how this can work to better deliver health outcomes for patients. Pharmacy can't practice in isolation. Pharmacy should support other primary health providers in a patient-centric model. And there will be a number of presentations on how that collaboration can work more effectively. The third topic is innovations in the modern world, creating opportunities for pharmacy. We've heard a lot about technology and its implications for our practice, artificial intelligence and medical technology. This will certainly influence how we practice going forward as we become more involved with disease state management and primary healthcare provision, whether that be with prescribing rights, which will happen in the short term. Certainly in the UK, by 2026, every graduate pharmacist will have independent prescribing rights. Responsibilities that come with this, technology that will assist with that. It's a very exciting field for pharmacy, as well as the automation that helps with our supply process. So that's a very exciting channel. There's some very good presenters who will speak to that, and that will affect everyone's practice going forward. The fourth topic is targeting special interests, and there are a number of presentations regarding smaller disciplines within the practice of pharmacy, such as surgical pharmacy, which is practiced in hospitals in China. And these are pharmacists who specialise in the selection and administration of medicines, both pre-operative and post-operative, to ensure that the best possible outcome from those procedures are achieved. It's quite an exciting small niche. We also have other special interests such as sports pharmacy, pharmacists who specialise in drugs for sport, so that they are experts in what can and can't be taken, how athletes can fall into the trap of taking a substance which may then be on a banned list, and also to give advice to athletes, sporting clubs, etc. Quite an interesting discipline which is growing in popularity and participation. So there's a broad range of topics at FIP this year at the World Congress, but importantly as well, it's a melting pot of pharmacist professionals practitioners, scientists and educators from across the world. And it's a great opportunity to meet with colleagues, exchange experiences and to broaden personal professional networks. I would recommend to everyone, if you are able to attend FIP Congress in Brisbane at the end of September, both professionally and personally, it will be a very satisfying experience for you. Key challenges for our profession here and how they look against what our colleagues overseas are facing. Remuneration obviously is a major issue. Governments and payers want to pay less for more. In Australia, we are just facing, in fact, tomorrow, the 1st of September, we'll have the start of 60-day dispensing, which will double over the next 6 months, 300 molecules or slightly more than 300 molecules will be able to be dispensed in larger quantities, which will have a significant impact on dispensing revenues for pharmacies. At the moment, the full impacts aren't known, and methods to mitigate those impacts are still being worked out and will work their way through the industry. Other challenges that we face here in Australia is to do with our journey on professional service delivery. COVID, which was a major impetus for expansion of scope of practice for pharmacists, has expedited a lot of things for our profession. Pharmacy stayed open during COVID. Many doctors went to a virtual model, and regulators and governments saw the value of the accessibility of community pharmacy and the potential that is effectively unused for community pharmacists to deliver further professional services. So the challenges are to adapt to be able to perform those services, which will add value to the pharmacy space. We know that at the moment there is a trial of a UTI trial happening in all the states. That is a great step forward for pharmacy. Minor ailments such as UTIs and conjunctivitis and cough and cold and potentially upper respiratory tract infections. These will all be part of prescribing trials which are happening and which will happen, and will give pharmacy a considerable armoury in terms of providing more services to their patients as pressure becomes more and more on capacity in general practice. So it's exciting times. The challenges associated with those professional services are that we do need to continually upskill ourselves. We have to embrace the notion of lifelong learning and be prepared to do whatever accreditation is required so we can provide those services within our pharmacies. The other thing that we must do is provide an environment within our workplaces, within our pharmacies, which effectively replicates the experience a patient would have in their doctor's surgery. So we need to accommodate within our fit-outs in our pharmacies professional services rooms where these services can be delivered in a private professional manner. We've seen that already with vaccination uptake in pharmacies, particularly since COVID with the availability of COVID vaccines through community pharmacy, has been significant. And quickly, pharmacy is becoming the default solution for vaccination administration within our communities. Other challenges we see are certainly workforce issues. The UN has said that by 2030, globally, there will be a shortfall of 10 million health workforce across the world. We're seeing that here in Australia, where pharmacists away from metropolitan areas are in very, very scarce supply. We need to have sufficient workforce to deliver against a program of improved primary health services that we can deliver through community pharmacy. So workforce is a big challenge. Maintaining and increasing a skilled workforce, a knowledgeable workforce, so that those services can be provided, because there will be more opportunity for that as we move away from a purely supply-based model. We need to be the best pharmacists we can be. And you'll be the best pharmacist you can be if you are skilled with the appropriate knowledge, if you adhere to regulation and guidelines, and you practice in a manner which causes no harm and no danger to the health and safety of the public. Now that's, of course, how we all should practice, but the challenge to maintain your currency with legislation, regulation, and your own literacy within your competency is more and more important. In terms of our well-being, we did see in COVID that pharmacists and pharmacy staff were put under extraordinary pressure. We lost a number of pharmacists in COVID who were at the front line, were infected and passed away, so that we do need to make sure that our workplace, we're not putting ourselves in harm's way, although with a COVID pandemic it was very, very difficult. We need to be conscious more and more of the mental health well-being of both our co-workers, our pharmacists, and our staff. As frontline staff, they can come under extraordinary pressure, particularly in demanding circumstances. So that's something that we need to be continually aware of and provide a work environment which is as safe as possible for both ourselves as pharmacists and for our support staff.